And we are back with our special edition of Coin 6 News, talking with Clark County Deputy Health Officer Dr. Steve Krager and Multnomah County Communicable Disease Director Kim Toevs with questions, and you can ask your questions through Facebook. Here's my question. I keep seeing this over and over again on social media, on Facebook. People comparing this to the H1N1 that we had in 2009 and saying, let's compare the two. And so they're saying this is from the CDC, that in 2009 to 2010, over a one-year period, 61 million Americans got H1N1. 274,000 people were in the hospital, and there were 12,000 deaths. So what I keep seeing on Facebook is, this isn't as bad as then. People didn't freak out then. Why is this different? Make the point to people at home who don't believe this is a big deal, why this is different.
So if you did the math on those numbers, what you would see is that the death rate, what we understand the death rate for COVID-19 is higher. People are becoming more severely ill at a greater rate than H1N1, and it has the likelihood to infect a lot of people like H1N1 did. I think the concern with how severe the infection might be for 20% of people that get it is that those people are going to need to be in the hospital. So, and that's a lot of hospital space if, half the population gets a virus and 20% of those people need to be in the hospital. And honestly, our hospitals would struggle with that capacity to be able to see that many people safely, as well as continue to see all the normal everyday things that hospitals do, see people with heart attacks and broken bones and all those things that need to happen that are critical. So that's why we are more concerned about this virus. It's the severity of it and that combined with how many people it could infect.
Yeah, if I could follow up on that, the latest statistics I saw that in China, where this started, that 3,100 people died. That's far less than die every year in this country from the flu. And they're saying, well, this is where it started, and that's not a big number of people who died. Mm-hmm. Again, why should we be concerned to this level?
It's a good question. I think so. China was responding to a brand new virus. They had incredible situation that they had to deal with. And honestly, I question some of those numbers. We've already seen Italy have maybe a quarter of the numbers that China had, but about the same number of deaths. So it's how things work sometimes, that we're not gonna be able to count everything that happens. So I think there's a lot of unknowns, and that produces some fear, but I think we're trying to base our guidance on what we see in other countries and now what we're seeing in other European countries as well.
So we have a lot of viewer questions too. I got a whole printout here. I don't have them by name, but I can promise you we've got all your questions here. I want to know, if I'm infected, is there a point in time when, say, this infection leaves my body and I can stop infecting others? Are you a carrier indefinitely? That's one part of this question, but I think a lot of people also want to know then, once I get it, will I be able to get it again?
So kind of two separate questions, I guess, there. Whether you can get it again is still up in the air. We don't know that for sure. And then how long you would have it, that depends on how severe it is. So some people have symptoms for a week, some people have symptoms for 6 weeks. It seems like from the data that we have, and Washington has some of this data really well tabulated, is 72 hours after a fever, and if your symptoms are improving, you're much less likely to be infectious. So if you haven't had a fever for 72 hours and your symptoms are nearly gone, the chance of you infecting other people is really slim.
And what about infecting people of all ages? I think a lot of folks are wondering this too, because we have seen a focus on this disease impacting older people and that population, but now we're starting to really enforce the social distancing with some of the younger folks. We're seeing them out on the beaches in Florida. We're really trying to hammer that home here locally. Stop going to the bars, stop doing that. So is there any new information about who this really impacts?
Yeah, so there was a report released this week from the CDC that kind of looked at numbers and who is fitting into what category and how many people were hospitalized. And it was significant, kind of the younger age group, 20 to I think 45 or 50 that they looked at, accounted for about 40% of hospitalizations. I think what we can take away from that is that there are still a large number of people in that age group that have underlying health conditions that are going to put them at risk. Some sort of lung problem like asthma or emphysema, some heart condition, diabetes. There's a lot of people in that kind of middle age or younger age group that still have some things that put them at risk. So, and beyond that, beyond just protecting people, your own age group, we absolutely need to make these measures to protect all the people at risk, including those that are elderly. So that's why we are stressing these measures so much. We want to protect all age groups, and we're just going to keep hammering that message home.
Well said, I think, because this is not about us or one person or even one age group. This is about everybody. At one point, we should probably start acting and just assume that we do have it. And that is how your behavior then should mimic that. Just pretend like you have it. Social distance, stay at home if you can. We've got so many more questions from viewers that we're taking today in our live event here for the entire hour. We'll go until about 5 o'clock. We got two experts here on hand, and we'll continue to take your questions when we come back.